Hello, my name is Ikra Hamayoun, and this is my T1 assignment for George Mason University's HAP 360 Information System class. My topic is on precision and predictive medicine. The objectives for this assignment are to determine the rate of success for citalopram among patients with anxiety depression, to determine the highest success rate for patients that have substance abuse, and which medication would have a high success rate for a patient with anxiety diagnosis. So what is precision and predictive medicine? The New England Journal of Medicine states that precision medicine is the prevention and treatment that is not new. It creates an approach that is more individualized, like a molecular approach to cancer, which allows for it to modify the already existing tests and treatments. Predictive medicine is a field of medicine that predicts the probability of a disease and takes a preventive approach to preventing such diseases or decreasing the side effects or its impact. So to start off the assignment, we have to first calculate the rate of success for citalopram. You will need to open up the Excel worksheet that is posted on Blackboard, and first thing you need to go to is go to the Insert tab, and then on the first side it'll say Pivot Table. You want to click that, and a little pop-up window will show up that says Create Pivot Table on the top. You want to select the settings that are already by default, and just click OK. After hitting OK, a table will show up on the right side of your screen saying Pivot Table Fields. On it, you will need to click Generalized Anxiety Diagnosis. You can either click on it or drag it into the bottom diagram under Rows. After that, you will need to select CIT Success under Values, and finally drag CIT Success into the column section on the bottom. Under the Values field, there is a drop-down arrow where it says Sum of CIT Success, and you will need to click on that and select Value Field Settings. Another pop-up window will show up after that. On the top, it will say Count of CIT Success, and on the bottom, you will need to click on Count and then hit OK. After that, a table will form on the left side of the Excel worksheet. It will say Count of CIT Success. On the bottom, it will say Generalized Anxiety Diagnosis, and it will show which ones have a success rate and which ones weren't. 1 means it was a success and 0 means it was not. Under grand total, it will say 117 were the patients that were benefited from the citalopram, and 366 were the patients that had anxiety out of those patients. After that, you will need to find the success rate, which, given the formula, is C7 divided by D7, which will give you 32% being the success rate for citalopram for patients with anxiety. For the second question, we will need to find the highest success rate of each medication that was used for patients with anxiety. This will help us see which one has the overall high success rate. You will need to go back to the pivot table, and you will need to change the columns and value section for each medication. For finding the BUP success, you will need to change the CIT success to BUP success. You can either drag that or click the check mark on the left side under the value and column field, which will give you a new chart and success rate. For BUP success, it was 21% rounded. You will need to do the same for SER, CT, VEN, NTP, and MIRT. The highest success rate for all those medications, CIT had the highest of 32%. For the final question, we need to find the highest success rate when a patient has substance abuse. You will need to repeat the same steps as you did for the first question, but instead you're going to change the generalized anxiety diagnosis to drug abuse diagnosis. And then for the value section, you will need to change it to CIT success and then change them to the rest of the different medications, such as BUP success, SER, CT, VEN, NPT, and MIRT. That will show you which one has the highest success rate, which is shown on the bottom. And after that, you will find out that BUP has the highest success rate, which was almost 38%.